right now, half Americans don't have a primary care doctor. It's any wonder they end up in urgent care centers. And the job of the urgent care center, which is usually affiliated or owned by the hospital system, is to get people into the hospital system, as is the job of the currently employed primary care docs. So the job is to get them into the big hospital, because some of them are going to get super expensive procedures, which are very profitable.
Right. Yes, primary care is absolutely central to the reducing of costs. What are other suggestions that people have, or niches or communities? There are, I think somebody mentioned, the Health Rosetta, this idea of like very primary care driven community health plan. So I think that's also an interesting question of like, what entry point is the right entry point? Is it community? Is it state? There's always a call for universal healthcare coverage in the US at the national level. And I just feel like maybe I'm too skeptical at this point. It would just like explode drama all over our entire system to even try something like that. So, is it county? Is it employer? Where do you guys think is the most powerful place that we could actually drive this kind of change to putting a primary care first piece, in place? And then we can also talk too about some of the like unseen areas. So things like the AMA's coding and RVU system and the way it's so specialty driven. Are there places there where you could make small adjustments that could end up having kind of like butterfly effect across the system to be tilting the world towards primary care?